Let me address a genuinely frightening scenario: the convergence of antibiotic resistance and kidney stones, specifically struvite stones that form due to bacterial infections and harbor bacteria within their structure. As antibiotic resistance increases globally, these infected stones are becoming potentially life-threatening when the causative bacteria become untreatable. First, let me explain struvite stone formation, which differs fundamentally from other stone types. Urease-producing bacteria, primarily Proteus species and Klebsiella, split urea in the urine, creating ammonia and causing urine pH to become alkaline. In this alkaline environment, magnesium ammonium phosphate crystallizes, forming struvite stones. These stones grow rapidly and can become large, sometimes filling the entire kidney collecting system in a staghorn configuration. Critically, bacteria become embedded within the stone matrix, creating a protected bacterial reservoir that antibiotics cannot reach. This makes the infection impossible to clear completely without physically removing the stone. The crisis we're facing combines two dangerous trends. Antibiotic-resistant organisms are increasingly causing urinary tract infections. Extended-spectrum beta-lactamase-producing bacteria, carbapenem-resistant organisms, even completely resistant bacteria are appearing in urinary isolates. When these resistant organisms cause struvite stone formation, we face stones harboring bacteria with limited or no treatment options. Children developing sepsis, bloodstream infection, from these infected stones may have no effective antibiotics available. Risk factors for this scenario are concentrated in specific vulnerable populations. Children with neurogenic bladder from spina bifida or spinal cord injury have impaired bladder emptying and often require intermittent catheterization, both increasing infection risk. The need for repeated catheterization creates repeated opportunities for bacterial introduction. Recurrent UTIs treated repeatedly with antibiotics over years create selection pressure for resistant organisms. We're essentially breeding antibiotic resistance through necessary repeated treatment. Prevention strategies must be aggressive and multifaceted. Aggressive treatment of initial infections before resistance develops means using appropriate antibiotics promptly and completing full courses. Removing struvite stones promptly before they enlarge becomes urgent when resistant organisms are involved. Small stones can sometimes be treated medically, but large stones require surgery. In high-risk children, prophylactic approaches to reduce infection frequency must be carefully considered, balancing prevention against further driving resistance through low-dose antibiotic exposure. The medical complexity of these cases is extraordinary. Children requiring surgery to remove infected stones while managing antibiotic resistance face prolonged hospitalizations, sometimes weeks, for intravenous antibiotics that may have limited efficacy. The antibiotics available for resistant organisms often have significant side effects and require careful monitoring. Permanent kidney damage occurs when treatment fails, either because the stone cannot be completely removed or because the infection causes irreversible injury even after stone removal. Public health implications extend beyond individual cases. Antibiotic stewardship is especially critical in pediatrics. Every unnecessary antibiotic prescription contributes to resistance. In children who will potentially need antibiotics throughout their lives for recurrent issues, preserving antibiotic effectiveness is crucial. Surveillance of resistance patterns in urinary pathogens helps guide empiric treatment while cultures are pending. Development of alternative approaches, bacteriophage therapy using viruses that target specific bacteria, immunotherapy approaches, enhancing the body's own defenses, represents hope for the future but remains largely experimental. The convergence of antibiotic resistance and kidney stones in children represents a perfect storm of modern medical challenges. Prevention through careful antibiotic use, prompt treatment of urinary tract abnormalities, and maintaining immune function through overall health offers the best path forward. For high-risk children, close monitoring and early intervention become critical. This is a situation where an ounce of prevention is worth far more than a pound of cure, because once we face infected stones with untreatable organisms, our options become terrifyingly limited.